door. If we see anybody come by, we'll snag them.
You lost soul like me.
Any lost souls out there? Yes, trying to get here. So, I'd like to introduce Heather France. And Heather, as some of you know, was a teacher here at Whatcom. She taught me when I went through the program. Now she's part of Peace Health's education team. And so I asked her, thank you very much last minute, to fill in, and I really appreciate, but she has this really cool de-escalation training, which has become really big in dealing with conflict patients and personal safety, and kind of more with the, see a lot of patients angry, looking for refills of meds and that kind of stuff, more showing up in the clinics. And so really getting some training on how to try and bring patients down has been their focus, and they've done a good job. So I asked her to come and share that with us, since everybody will encounter that in their jobs, no matter where you work. So it's good. So take it away.
Yay! Well, thank you guys for inviting me. So yes, just like Christy had mentioned, I'm going to be covering some de-escalation techniques, and as you guys, well, some of you who work currently as MAs or are going to be MAs, it is for sure that you're going to eventually encounter some of these problems. So some of the things that we're going to talk about today is identifying some of those behaviors and signs that you have an escalating patient. What does that look like? What do you do? We're going to utilize some verbal and nonverbal strategies on what you can do to keep yourself safe and kind of calm the patient down. Then we're also going to talk about maintaining personal safety, and we're going to look at and get up and actually model some of these safety techniques that you can do if you have a patient that is escalated to the point where they come at you. So we're going to look at a little bit about that and what some of those techniques are to keep yourself safe. So, identifying an escalated client. Okay, we obviously have some things listed up here on the board, but who has ever been angry before, right? So what are some of the things that you have exhibited when you feel that you were escalating? Shout off some to me. What do you think?
Face gets really red.
Okay, reddening in the face. That happens to a lot of people, for sure. What else?
Voice gets louder.
Louder voice.
Shaking.
Shaking, fidgeting. What about eye contact?
Hearing all over.
Okay, sometimes they have really erratic, sometimes they can't make eye contact at all. Sometimes they like to do this. We call this the super stare. Okay, you get really irritated, and if they don't like to take their eyes off of you, and this can lead to, for some reason, either maybe fear, frustration, some of those things, they will exhibit that. So the first one that we're going to talk about is fear. So fear can look like maybe it's cowering or backing away. When you are showing fear, what are some of those things that a patient will exhibit? When you are fearful.
Kind of folding into yourself.
Okay. So maybe, like lack of wanting to touch or be touched or something like that. What else?
Shutting down, like not talking.
Okay. Somebody who maybe be very vocal and, talkative may just totally shut down and not want to communicate.
I knew someone who had like uncontrolled emotions, in particular laughing.
Absolutely. So it's funny that you mentioned that, because in our full 8-hour training that we do at Peace Health Medical Group, we talk about the importance of when we're coming in support of our peers that are dealing with an escalated patient, the importance of making sure that you as caregivers do not laugh when you feel very uncomfortable, or the patient's just totally popping off things that are just totally erratic and they don't make any sense, and when we get nervous, what do? Or and so we have to be really careful that we ourselves are not laughing at the situation. So our goal to calm a fearful patient down is to make our client feel safe. So some of these things that we talk about is we want to make sure that we have a relaxed posture. If we mimic how that patient is feeling, being really fearful, we're having difficulty communicating with them, maybe we're having difficulty with lack of eye contact, You know, we're showing a lack of empathy that can really affect our patient and really amp them up to the next stage. So we want to really kind of try to be mindful about how we are acting with that patient. So relaxed posture, having your hands in open view, making sure that they know what to expect. So if we are saying, let's say for a child, we're going to go in, we need to do, you know, immunizations or something. We need to let the patient know what to expect. So we're not going to just, you know, try to jump in and just do it real quick so they don't expect it. That's going to cause more fear, more anxiety, more pain. So we're not going to invade the client's space. We're going to let them know before we do it. So this is, you know, Claire, I'm gonna swab your arm with the cotton ball here that has some alcohol. It's gonna be kind of cold, and then after that, we're gonna let it dry, and then I'm going to give you the, so just kind of walking them through the steps of what to expect. It may be a little bit painful, it may sting a little bit, but it's gonna go away within a couple of minutes. And once that happens, we'll put a sticker on you, and then you can go. So just kind of through the steps and what that's gonna look like and what they can expect to feel. Using a soft voice. So oftentimes too, when we get a patient that's really fearful, what do we want to do? Honey, it's okay, it's okay, it's okay, it's okay. I'm really high, and the nurturing type of instinct pops in for us. But that can oftentimes escalate our patients too, that they get, it's very irritating. It can sometimes seem like it's very non-sincere. So really just trying to be yourself and stay calm, stay monotone with a soft voice. We're not making erratic movements or anything like that. Also making sure that we use phrases that reassure them, such as, I just want to make sure that you feel safe, or, I'm not going to hurt you, reassuring them that they are in good care and that you want to help them. The next type of patient that we sometimes can come across is a frustrated patient. So frustration, what does this look like? I've been here for 15 minutes and I am so sick of sitting here waiting. Okay, what did I do?
Loud.
I raised my voice. Right? What about my facial expressions? Do you notice I raised my eyebrows? Kind of got a little attitude. Okay? I'm putting my hands on the table. I'm frustrated. I'm physically acting out to the table. One thing I want to bring up, does this, I'm going to let my inner patient out here for just a second, so bear with me. I don't want to be here! This is stupid! You don't know what you're talking about! Okay? I am frustrated. I am physically acting out, right? But is this causing harm to anybody?
No.
Okay? Those are the questions that you have to ask yourself when you're talking about an escalated patient. Is what is happening this person physically needing to let out their steam, and is it causing harm to anybody else or to themselves? That's what we always ask ourselves. If they throw a chair across the room, okay, granted that is not acceptable behavior, but there's a difference between picking up a chair and throwing it across the room versus picking up a chair and throwing it at you, right? Big difference. And we need to make sure to pick up on those cues so we know if we are in harm or if this is simply lashing out. There's a big difference. So if it ever does come to calling the police, they're going to ask you some of these questions, and you have to really think back. Well, was that chair being thrown at me directly, or was it being thrown out of aggression at a wall and it didn't cause anybody harm besides maybe the wall? Okay, so tensing of the muscles. We have leaning or moving forward, reddened face, banging, screaming sometimes, verbally, lashing out, those kinds of things. So our goal is to make our client feel like they have some control. How do we do that? How do we allow our patients to feel like they have some control? Any thoughts that come to mind really quick? Yeah.
I always try to give them the feeling like we're listening.
Definitely. So when you feel like you're trying to make them feel like you're listening, what are some of those skills that you do to demonstrate good listening?
If they state something, I may rephrase the question, or I may restate it. I say, now if I understand what you're saying is.
So you paraphrase.
Yeah.
Excellent. What else? Active listening skills. Let's think about this. Kind of off the topic, but it's important to know what that looks like.
Maintain eye contact.
Good. Eye contact. What if the patient doesn't want to make eye contact? What do you do? Any ideas? Do you try to make them make eye contact with you? Okay, no, that's going to increase your patient's anxiety. What you want to do is, we often rephrase this as mimicking the patient's behavior. So if you see that, you know, they're kind of fearful, they're getting a little bit frustrated, and you can see that they look at you and then they look away. And then they look at you and then they look away. You mimic that same behavior. You ask them a question and you look away. You don't engage in forcing them to make eye contact if that's something that they're not choosing to want to do. So standing your ground is really important. Why is this important when we are trying to get across to a frustrated patient?
You don't want to give them the upper hand. You don't want them to make or feel like they're the ones who are in control.
Yes. How many of us have kids? Okay. Those of us who do have kids, how many of you have given in to one of your child's demands, and then what do they expect from you the next time that they ask you? They expect it again, right? So standing your ground is really important, because we're setting up that expectation that here is what I can do for you, here's what I'm willing to do for you, and that is it. And you leave it at that. So nodding your head up and down, this is really reassuring the patient that you're understanding them. This is a part of active listening. Yes, I understand. You know, maybe paraphrasing back to them what they're saying to you, those kinds of things. Stand directly in front of your client, but outside of their striking range. So that's kind of playing a big role in looking at the safety of where you're at, your environment. Making sure you don't have any objects in your way where you know where your exit is. So stools, chairs, desks, you know, cord, whatever. I would hope that there's not cords in the way where you have a patient walking through, but you never know where the situation can break out. So paying attention to the environment is really important as well. Match their eye contact, do not touch the client, speak in low tones, some of these things that we've already kind of touched on. Being repetitive and clear about giving directions about what you're wanting. So again, we call this the broken record technique. I understand that you really want to have this prescription refilled, but unfortunately, Dr. Scott wants to make sure that we get you seen before we give you this prescription. I don't want to go and see, I've already seen her, I don't want to come in. I understand that you're very frustrated about this, but the reason behind us needing you to come in is we want to make sure that we have the right dosage and everything is correct in your chart, you know, so that way we're making sure that we're giving you the right kind and the right dose of your medicine. It's really important that we have you come in. Ugh, I don't want to come in. Do I have to come in? Yes. Unfortunately, you do have to come in if you want to have your prescription refilled. So why don't I go ahead and set you up for the 8 a.m. appointment for tomorrow? Do you have anything at 9? Okay. Right. You just keep sticking to your ground. You do not take no for an answer. And if they choose not to follow what you're trying to say, you give them the consequence. Unfortunately, you're not going to be able to have your prescription refilled if you don't come in and see Dr. Scott. That is your bottom line, right? And you stick to it. So the last one that is the big one here is we want to offer them choices. This is the biggest thing that helps them feel in control, even if it's something simple like, would you like to sit in the chair or would you like to sit up on the table? Some of the other ones, would you like to take your pill now or in another 10 minutes? Granted that it's not one of those medicines that they have to be given it at that certain time, but giving them that choice, would you like it now or would you like it in another 15 minutes? I can come back. Would you like to wait here for your ride in the waiting room or would you like to go elsewhere, go outside or whatever? All of these things help your patient feel in control because they are making the choice between A or B. And when they get to make the choice, they feel like they have control. Okay, next one, manipulation. That's our next patient. So manipulation, what does this look like? Temper tantrums, right? Patient throwing a fit when their demands are not met. Violence is threatened by appearing to lose control, such as yelling, banging, stomping, all of those kinds of things. That can be either a sign of frustration and true frustration because they're really acting out due to frustration, or it can be a tactic to get what they want, which is what we're looking at here, which is manipulation. Also, these types of people will play the numbers game and trying to split you guys up. So we have a group of people working together. Well, Christy told me I could get it refilled and I didn't have to make a prescription, or I didn't have to make an appointment. So then so the patient is then trying to take what I said and taking what Christy may or may not have said and trying to flip it around, so that way I'm frustrated at Christy, and then I go back out, Christy, God, why did you let him schedule the appointment without being seen and with the prescriptions, blah, blah, blah. Now I'm frustrated at Christy, and it's totally taken my focus off of the patient and put it on somebody else who doesn't even necessarily deserve it. So they'll play the numbers game. That can be another thing that they'll do. Also, this just promotes confusion. When everybody gets really confused, oftentimes whoever will just give into those demands because it's easier to just meet what they want rather than to continue to argue and, find out plan B, what are we going to do, all of those different kinds of things. So that is their goal. So what do we do to help the situation? Hi, Sandy.
Hi, Heather. Good morning, class. Good morning, class.
So your goal is to make sure that we have healthy re-engagement of the patient. So how do we do that? Oftentimes when we have the patient just, on and on and on, and we're trying to get something done, okay, what we say is we want to position yourself far away enough to show non-involvement, but without turning your back as if you don't care. So this means something like, Kelly, I need you to, I would be willing to talk to you, but I need you to lower your voice and sit down. And Kelly's just ranting and raving, okay? I can turn to my computer screen, so I'm not totally disengaging her, and she's not going to try to come over and try to, hey, I'm talking to you. I'm not done with you, okay? I'm still here. I can see her. Kelly, I really need you to lower your voice first, and I need you to have a seat, and then I'd be willing to talk to you once you can calm down. And I re-engage in what I'm doing. So kind of that, taking her out of and showing that I'm not engaged in her bad behavior, but I'm willing to meet what she needs once she listens to what I have to say, my demands, and she listens to that. She comes and has a seat.